childcare and services for your child after it exits the womb. To start, lack of access to affordable healthcare. Healthcare in the United States is known to cost an exorbitant amount of money, significantly more than most other high-income and developed countries. In fact, according to the U.S. Department of Health and Human Services, the United States has the highest maternal and infant mortality rates among high-income countries. These mortality rates could be decreased if healthcare were made to be affordable, as Obama's Obamacare Act attempted to. My second point today is a lack of access to affordable childcare and services for your child after it exits the womb. According to the U.S. Department of Health and Human Services, childcare for a single child can cost a family upwards of $600 a month for a singular child. Add 2 or 3 kids upon this, and you could be paying up to $2,000 just to send your child to daycare before they go to school. President Biden planned to introduce a bill that would cap childcare costs at $10 per child per day, no matter the daycare you send your child to, with a couple exceptions being religion and certain different services that the daycare would offer. This bill would significantly help families decrease their cost of living, as they would be able to afford having a child and sending their child to daycare. My third point is an increased cost of living over the last 2 to 3 decades. According to the Center for American Progress, cost of living has increased significantly over the last 2 decades. In fact, according to a study by the Pew Research Center, as cost of living increased, birth rates and fertility decreased. This is especially obvious after the financial crisis of 2008, where cost of living skyrocketed for a year or so, and birth rates significantly decreased because people were not able to afford having a child. My final point today is a study of our healthcare system. American healthcare is spotty at best. It doesn't work out, and when it does, it only works out for the people that it wants to. Maternal healthcare is extremely inaccessible for most people. For example, abortion services. According to a Texas news outlet, a young mother miscarried and could not get an abortion because of the fact that the baby was considered to be alive, yet the baby was dead inside of her. And this may be gory, but she literally died due to a septic infection that her child caused. An abortion would have fixed that. Well, governmental bills have made healthcare and abortion services significantly, basically impossible to access for multiple people. That Texas study is just one of many. There was another case in Alabama where a 17-year-old mother passed away because of the fact that she had an ectopic pregnancy where the baby never left the fallopian tubes, and she went septic, which is an infection of your bloodstream. She never recovered. These 2 case studies are examples of what our government has done to us by blocking healthcare accesses. The overturning of certain bills has blocked healthcare access and has made healthcare inaccessible and unaffordable for several American families, mothers, and children. In conclusion, the U.S. fertility rate is decreasing for several reasons. Number 1, increased cost of living, which affects having kids in general. Number 2, lack of access for childcare and services for your child. And number 3, lack of affordable maternal health care and healthcare in general. And remember, when you ask, would the government really do that? Yes. Yes, they would.